स्टार्ट हो रहा है और ओके।
Good evening, parents. We are delighted to welcome you to this yet another informative and interactive live session focused on raising awareness about an important topic that deserves wider attention. That is, respiratory syncytial virus, RSV, and its immunization. RSV is a potentially life threatening respiratory infection that can lead to severe breathing difficulties and complications, especially in the newborns and infants. So, this is because their lungs are still developing, and infections at this stage can cause some very serious complications and hospitalizations, of course. RSV has emerged as a significant health concern in the past couple of decades, and an alarming data from the WHO, World Health Organization, reveals that RSV is responsible for 3.6 million hospitalizations and nearly 1 lakh deaths annually in children under the age of 5. And the risks are even higher for babies who are born prematurely. But fortunately, we can protect our little ones from RSV through nirs- nirsevimad immunization, a scientifically backed and expert recommended method to alleviate the risks associated with RSV. In, in fact, a study by NIH shows that this immunization has shown at 83% reduction in hospitalization in the real world clinical setting. In this workshop, we will be learning about RSV and why immunization is crucial for children. And for this workshop, we are privileged to have Dr. Gaurav Gupta, who will offer some valuable insights. Dr. Gaurav Gupta, thank you so much for joining us today. Please share your thoughts on today's topic.
Thank you, Neha. Thanks for giving a very nice overall summary about what we're talking about. Nirsevimab is a handful. It is difficult to pronounce even for doctors, so I can understand. But basically, we are talking about cough, cold, fever in small babies. Now, we are always worried about cough, cold, fever in small babies because we all know the pediatrician will tell us child can get pneumonia, child may need admission, all those things. Now, in the first 6 months of life, if your child gets cough, cold, fever, as a parent and as a pediatrician, we are extremely worried. Why? Because it can cause serious problems. Child may need hospitalization, ventilation, etc. He or she can become very serious. This particular product, which we are going to talk about today, nirsevimab, is a monoclonal antibody. It is giving passive antibodies to the baby with the simple concept that we can prevent anywhere from 20 to 40% of such infections and even 70-80% of serious infections with cold, cough, and fever due to one particular virus, which is RSV. That is what we are going to be talking about in the next half an hour, 45 minutes.
Thank you, doctor. That information really helps the moms who would be watching this Facebook Live. There are some more questions that I would be asking you. But before we continue on that, I want to let all the parents who are watching us right now know that we are taking the questions on this live session. And if you have any queries related to this topic that we are discussing today, please feel free to write them down in the comment section, and doctor will definitely address them. Moving on, doctor, could you please help us understand what is RSV immunization and how does it actually work?
So immunization is actually not the right word because we are not giving a vaccine in this situation. We are giving antibodies. So the difference, Neha, between a vaccine and an antibody is that a vaccine will help your body produce antibodies to fight a disease. Like, for example, we have different vaccines for hepatitis and typhoid and DPT, etc. And of course, COVID vaccine also. These vaccines help your body produce antibodies which fight against various diseases. For RSV, we are not giving a vaccine, we are giving antibodies, which means we are directly giving protection, not asking the body to produce antibodies, but we are giving these antibodies directly to the baby. And that is something which helps protect our baby against RSV infection, which is a very, very common reason for small babies getting hospitalized for up to 5 months. So one dose works for almost 5 months or more in preventing your baby from getting serious chest infections, which go by the name of pneumonia, bronchiolitis, and many other similar problems.
And doctor, at what age should a baby receive this RSV immunization?
So that's a very good question, Neha. The age recommended depends upon which country you are in. For example, if you are born in USA, then the age would be before the start of their winters, which means October to March. So they would say give it in September or October or December or even to March. Now, if the baby is born in Australia, then in Australia the winters happen ekdam reverse. So then they would be recommending the vaccine from March onwards, March, April up to June, July, because their winters happen that time. So the important thing is that in these countries, RSV is a winter virus, and therefore we give it at that point of time. But coming to a country like India, which falls in what is WHO says is the tropical zone, here RSV occurs throughout the year, and interestingly, the maximum number of cases occur right now, which means during the monsoons, in the rainy seasons. And therefore, our season for RSV starts somewhere around June, July, and it goes right up to the winters. So we get cases right up to December, Jan, and Feb. So we have a much longer season. Each area in India has a different type of circulation of RSV. But the bottom line is monsoons and winters is the time to give it in our country, but we have year-round circulation also.
And doctor, is it safe for children? Is this immunization safe for babies? And does it have any side effects as well?
So this question gets asked by parents all the time for every vaccine, for every medicine. And the thing which I want to take maybe a couple of minutes this time to tell you about this is, I always ask parents, do you know how vaccines are made? Okay, so first of all, nirsevimad is not a vaccine, it's an antibody. But generally, how is a vaccine or an antibody or any product which is used in babies, how do we create that product? We have study which is phase 1 study. This is done in rats, it is done in monkeys, it is done in rabbits, all animals. Once the product is found to be safe, then we do phase 2 studies in which we have human volunteers who take the vaccine in very low or the drug in very low doses, and then they take it in higher doses to see for the effect and for the side effect. If this is found to be safe, then we have phase 3 studies where when we give this medicine drug to thousands of people. And then in this thousands of people, we again check for the same thing. Is it safe? Is it effective? Is it causing any serious problems? And once this is done, then it has to be submitted. The data has to be given to a group of experts who will then assess this data and say, okay, this makes sense. Let's put this into the market. Once the medicine is put into the market, afterwards also there is something called post-marketing surveillance, which means even after a drug or a vaccine has been put into the market, it has been given to kids, we still follow up and see for any serious side effects. This is the kind of research that happens for every vaccine, and it has happened for nirsevimab also. So to answer your question, it is an extremely safe product. It is antibodies, and these antibodies are absolutely not having any problem. It is to be given at the time of birth or before the start of the RSV season, as we discussed in the last question.
And doctor, does it mean that giving this antibody would mean that baby will never have the infection at all?
So nothing in the world is 100%, including a vaccination and including antibodies. But the good news is that we have enough data to suggest that there is 70, 80, even 90% protection which means 9 out of 10 babies who take this antibody are not going to get the disease. What about 1 out of 10? It is very likely that even this one child, if they have taken the nirsevimab antibody, they will get very mild disease. So it is a very good chance that your child, if they take this, will not ever need hospitalization because of RSV if they have taken this particular antibody.
Of course. And are some babies at any sort of higher risk of developing RSV complications than others?
That's a very good question, yeah, in fact, and this is something that was the reason why this product was actually researched first, because we felt that a lot of preterm babies, low birth weight babies, babies with some heart problems, baby with some lung problems, babies who had received ventilation when they were small, all these babies, and we are getting more and more such babies which have complicated course while they're staying in the ICU, NICU, or in the hospital. Many of these babies, when they grew up and over the next 1, 2, 3 months, they got the infection, maybe from a family member, maybe from an elder sibling, they ended up with a lot of complications. Now imagine, first you have spent 1 month, 2 months, and you have spent lakhs of rupees just trying to get your baby out. He was born, they were born very small, and they had to require a lot of efforts. So every day, day in, day out, you were spending so much time, money, effort. Now the baby has come out, he's gone to the home, and then when they suddenly has this cough, cold, and then they come back with very serious chest infections. And so preterm babies, low birth weight babies, babies with heart disease, lung disease, they were the ones which were initially thought to have more complications because of any viral infection, including RSV. And these were the children that we started with targeting with this particular nirsevimab monoclonal antibody. Though, of course, now later on, we have said that it should be given to everyone.
And doctor, I also want to understand how many doses of this RSV antidote does a baby need and when do they need that? If you could please elaborate on this.
Again, wonderful point and a good question. So the number of doses for this is only one, which is to be given, as I said, either at birth, generally within 5 to 7 days before discharge. That is the best time. The other way it can be done is to be given before the start of monsoons or before the start of winter season. Both are fine, but the first dose should be given before the age of 8 months in the baby, so that you get a good protection. So that is when you give the first dose. If the baby is below 5 kg, then you give 50 milligram, which is slightly lower dose. And if the baby is above 5 kg, then you give 100 milligram, which is a slightly bigger dose. That is the time to give this vaccination. And accordingly, the protection lasts. Some babies may require an additional dose in the second year of life if they have these things which we talked about last time. If they have any lung disease, if they have any heart disease, if they had a problem, they required ventilation, etc., then they might need to be given another dose in the second year. But otherwise, one dose to be given either at birth or at the start of monsoons or winter. That is what is the recommendation.
Sure, doctor. We have spoken about the antidote, of course. I also want to understand how does this RSV spread in babies?
Okay, so from talking about the antibody, now we are going back to talking about the virus. So the virus is extremely common. 2 out of 3 babies are going to get infected by the time they are 1 year. And literally, you'll be surprised to hear this, Neha, that literally 100% children will have RSV before they are 2. So every child is going to get it. The good news is for most of it, it is going to be mild cough, cold, fever. It will be better within 4, 5, 7 days. But we really don't know if your child or my child is going to become very, very sick with RSV. There is no easy way to predict this. And that is why it is recommended that everybody should be given this particular antibody, preferably in the first 8 months, maybe even at birth. So RSV spreads just like most other virus, just like flu, just like COVID. If you sneeze, if you cough, if you have touched something wherein somebody has sneezed or coughed. So if you're in a close contact with somebody, in a way like any other respiratory infection through droplet secretions. That is the way RSV gets transmitted. It is very easily transmissible, and that is the reason why people get it. Everybody gets it by the time they are 2 years old.
And apart from this RSV immunization, what other measures can be practiced against this RSV?
So we just talked about the things that we need to be careful about. We need to make sure that if there is somebody who's unwell, they should not be around the baby. The most problematic thing is kissing the baby on the face. Everybody wants to do that. The parents want to do it. The elder sibling wants to do it. The relatives want to do it, and that is the worst way of doing it, because then you are actually giving all your nasal and oral viruses directly putting on the face of the baby. So please avoid doing that. Don't kiss the baby on their faces if you want to show your love. Beyond that, hand hygiene is very important. During COVID, we were all doing a lot of sanitizer and all, but now it's all gone back. But I think it's a good way of reducing. And then if you have any cold, cough, and fever, if you have to take care of the baby, wear a mask. But otherwise, try to avoid getting in touch with the baby. This is especially important if the elder sibling has it, because the most common source is the elder sibling. They go to school, they get the infection, they bring it here. RSV can cause reinfections also, and so they bring it to the house and then they go and kiss the baby on the face. So these are the common ones. Beyond this, breastfeeding for more than 3 months has been shown to be very good. So if you have a parent, we always encourage them exclusive breastfeeding for 6 months. It prevents a lot of problems, Neha, including RSV infection. It is protective, and therefore it is recommended that exclusive breastfeeding should be practiced. Crowded locations should be avoided, and smoke and all should be reduced. This is true for all viruses, including RSV.
That was really helpful, doctor. Now we know that proper sanitization is very much important whenever we are around the babies. That would help us protect them from
Absolutely.
RSV. And of course, doctor, I also want to understand how long does the impact of this RSV antidote last?
So the antibody RSV is definitely going to work for a period of 5 months. So the difference between this and the vaccine is that a vaccine, once you give into the body, then it keeps on producing antibodies, and the effect may last much longer, for sometimes for months, sometimes for years, sometimes even for your entire life. But for antibodies, their effect starts to wane off with the passage of time. So it is important to know that antibodies will never provide you years of protection. They may provide you months. And for this particular antibody, we have 5 months of protection. The good news is that this protection starts very fast, because you're giving it at 7 days or birth or whenever. You need the protection now. You don't need the protection after 1 month. Vaccines will take much longer to start protecting. They may work for a longer period of time. Antibodies will work immediately. And in this case, it works for almost 5 months at least, maybe a little longer than that.
Doctor, you mentioned that RSV can be uh, transmitted from the elder sibling to babies because they go out, they go to school. I want to understand, can it also be transmitted from babies to their elder siblings?
Sure, that's true. The good news is that RSV is a serious problem in smaller babies. So elder bachche ko, what is going to happen? They're going to get cold, cough, fever. A 5-year-old with RSV, a 7-year-old with RSV is not going to cause medically serious problems. They may need to visit their pediatrician, but beyond that, hardly anything. But the reverse is a problem. If the smaller baby gets it, they may get pneumonia, they may get bronchiolitis, they may need nebulizers, they may need oxygen, they may need hospital, ICU, even ventilation. So I'm not too much worried about a small baby giving it to the elder one. I'm far more worried about the elder one giving it to the smaller baby.
Since we are discussing about this RSV immunization, there are a lot of questions pouring in from parents who wants to understand. Let's start taking the questions from them. The very first question is coming in from Shipra, who wants to understand अचानक से सब आरएसवी की बात कर रहे हैं, इसका क्या रीजन है? What would you suggest?
Okay, so Shipra ji, the reason is very simple. You have something to manage this particular condition now. आज से पहले हम आरएसवी की बात इसलिए नहीं करते थे बिकॉज इफ वी वर टॉकिंग अबाउट आरएसवी, आप पूछते थे क्या करना है, हम कहते थे जैसे हम सारे खांसी जुकाम बुखार का इलाज करते हैं, नाक में सलाइन ड्रॉप्स डालिए, पैरासिटामोल बच्चे को पिलाइए, और अगर ज्यादा प्रॉब्लम होगी तो फिर आप आके हमें दिखाइए. सो देयर इज ऑलवेज अ बायस. We talk about things for which we have certain treatments available, certain prevention available. So, जब हमारे पास, we talked about cervical cancer vaccine a lot when we started having cervical cancer vaccine available. Then we started talking about cervical cancer. It wasn't कि पहले बच्चेदानी का कैंसर नहीं होता था. Of course होता था. But once we got the vaccine, we had a way to prevent it, and therefore we started talking about it. Now in India, for the first time, we have a way to try to prevent RSV infections, which is the major cause of admissions in hospitals, in clinics, major cause of coming to the doctor. So by taking this particular antibody, which was not available previously, you can reduce the chances of having to visit your pediatrician, more importantly, needing hospitalization and ventilation for your small baby. And that is why, Shipraji, we are talking about RSV now. It doesn't mean that RSV is a new virus. It doesn't mean that pehle RSV hota nahi tha. Just like we talked about cervical cancer, it wasn't कि उससे पहले cervical cancer था ही नहीं. In fact, the reason you get these products is because it is a big problem. So when a company looks in terms of what product to make, they look at things which are causing serious problems. And that is how we research. And doctors do the same thing. And now we have a product, Shipraji, and that's what we are talking about. I hope that answers the question.
Similar to this, we are getting a question from Feza who wants to understand. My niece and nephew were not immunized, but they are fine. One is in 10th and the other is in 6th class. So, why does my baby need it then?
So that's a wonderful question. It reminds me of, it reminds me of what we say I'm in Chandigarh right now. Chandigarh has a very, very strict traffic rules. As soon as somebody leaves Chandigarh boundary, they remove their helmet, they remove their seatbelt, because outside Chandigarh nobody gets challan. And people tell me, doctor, we never had any accident. 15 days, 15 years, we were driving without a seatbelt. Now, what is this government coming out with this nonsense about wearing seatbelts? Okay. So just because you haven't had an accident, just because I'm happy your niece and nephew are absolutely healthy, just because they haven't had a problem does not necessarily mean that your child cannot get this problem. And that is why it is important for us to protect our children in the best possible manner. You are a wonderful parent, I'm sure. So you want to make them wear the seat belt and the helmet, even if and your nephew nieces are also, they didn't have that particular option. So maybe their parents would have taken that too. This is like an insurance. You don't take an insurance saying कि गाड़ी का accident होने वाला है. You take an insurance hoping कि गाड़ी का accident नहीं भी हो, but अगर होगा तो we protect ourselves. And that is the way all vaccines work. You take them because you want to protect your children and make them healthy and let them stay healthy, protect them against the maximum number of diseases possible. I hope I've been able to answer that.
That was a perfect way to explain this, doctor. Moving on, we are getting a question from Amrit who wants to understand. मेरा बेटा healthy born हुआ था and full term. ये फिर भी करना पड़ेगा क्या? What would you suggest?
So I think the audience is extremely, extremely intelligent. They are asking, even the first three questions have been very, very perceptive, and people have actually paid attention to that also. Thanks everyone for listening in properly. And the answer to that is uh, WHO has, the World Health Organization has just come out with a paper. I mean, it's a technical paper, but I'm sure most parents can understand. It has just come on May 30th, 2025, just less than a couple of months back, right? And they have clearly said, and this is nothing to do with any particular company or anything, they have said every child, especially in a developing country, they use the word LMICs, low and middle income countries, should be offered this particular antibody if it is available, if they can afford it, because 70% of children who are hospitalized due to RSV are not having any high risk. So this is confusing. We talked about high risk. We said preterm hai, lung disease hai, heart disease hai, to zyada risk hai. But remember, 7 out of 10 children who are admitted in a hospital because of RSV do not have any of these. They are just like your and my child, absolutely healthy, full term, no problem at all. उनको admission का risk ज़्यादा है, and that is why the WHO says very clearly, as far as nirsevimab is concerned, it is a universal recommendation for each and every child if the country, if the population can take the vaccine.
Moving on, we are getting a question from Lavanya, who wants to understand how to tell if the baby has common cold or is it due to RSV. What would you suggest?
A fantastic question. So, Lavanya ji, we don't really need to test every child with common cold. See, as I said, 2 out of 3 children will get RSV with a cold-like symptom by the time they're 1 year. And 100% of children will have RSV, again cold, cough, fever by the time they're 2 years. So मान के चलिए कि your child, my child, everybody is going to get RSV. The problem is when this RSV is going to cause serious complications. Now there is no way for you and me to figure that out. If the RSV is not going to cause complication, then what is the fun of diagnosing? If I say your child has RSV, but he just has cold cough, so I'm anyway going to give paracetamol, saline drops, and say go home. So why do I need to diagnose RSV? I only need to diagnose RSV if I am concerned that my child or your child is potentially going to get into complications. So the warning signs are much more important. So if the child is not feeding well, if she is not eating well, if she's having a lot of very fast breathing, if extreme irritability, extreme lethargy, very lethargic child, not feeding at all, not passing urine at all, this is the child where I'm worried that this child may require hospitalization, may require ventilation, and this is the child where I would be concerned about testing this child. Because let us say if it is RSV, then we don't need to give very high flown antibiotics. Because if I'm thinking bacterial infection, small baby, I'll put IV, I'll give all IV antibiotics, strong antibiotics into the baby. But if I'm thinking RSV, I may either not give antibiotics or stop them as soon as I get the cultures negative. And that is the purpose of doing RSV testing. That being said, now we are getting kits of RSV which are relatively cheaper. Previously, these kits used to cost 12,000, 15,000. Nowadays, we're getting combination kits which have COVID, flu, RSV, all of them with just a nasal swab like we used to do COVID testing. And these kits cost probably less than 6,000, somewhere 3,500, 4,000. So it can be tested. But Lavanya ji, my point is I would not be interested in testing it unless and until my child is very unwell. And in that situation, definitely if a child is being hospitalized, it is worthwhile spending this much to find out why the baby is getting into trouble.
Another parent named Gayatri wants to understand that I thought ये premature babies को ही होता है बस RSV का खतरा, मगर क्या सभी babies को करवाना पड़ेगा?
Yeah, so first of all, Gayatri ji, congratulations. You actually knew of RSV and you were actually able to have this concept that it is there in preterms. I honestly don't know if too many parents in my practice knew this term also RSV. So I'm really happy you were already aware of this. Again, this question has been asked before in a slightly different way. Preterms, heart disease, lung disease, low birth weight, all of these are high risk factors. If your baby has any of these conditions, their chances of complications are much more. The chances of my baby, if he has all of these conditions, getting hospitalized are much more than a child who's healthy full term. One part. Absolutely, we are on the same page here. The problem is the other part. 70% of children who are admitted because of RSV do not have this. So 70% kids are healthy, full term. There have been no problems. They've been breastfeeding very nicely. They didn't have any complications. They never stayed in a hospital. They just took the routine vaccine. Elder safe came from school, or some relatives came, kissed on the face. Child started having cold cough, no problem, went to the doctor, took regular medicines, absolutely fine. But after 3 days, 4 days, 5 days, the child started worsening, more cough, cold. You started some steam, nebulizer, whatever. And now the child is not feeding, and then you have to hospitalize. Then you test, and it turns out to be RSV. So 70%, 7 out of 10 kids are admitted who are like this. And that is why the WHO says that there is no point of restricting this to the high risk category. The high risk category should be convinced even more. But because a majority of children who are getting admitted due to RSV are not high risk, therefore it is important for us to try to vaccinate everybody. And this is being followed across the world. Spain is doing it, France is doing it, Australia is doing it, US is doing it. All the developed countries are now going to give this to all the babies as soon as they are born, because they know that this prevents a lot of complications in small babies.
Another parent named Shilpa wants to understand इस immunization से आखिर होता क्या है? मतलब RSV completely नहीं होगा या फिर होगा मगर serious नहीं होगा? What would you suggest?
Again, a very, very nice, slightly tricky question to answer. Okay, so most vaccines work in 2 or 3 ways, right? I'll take the example of the most controversial vaccine, which is COVID. Everybody thinks that everything which happens bad happens because of COVID. If I lose money in the stock market, it is because I took the COVID vaccine. Okay, so let's start with that. So the premise of the COVID vaccine was not that it was going to prevent COVID. Shock. The reason we gave COVID vaccine was that you don't get hospitalized and you don't die because of COVID. And even there, it was 70-80% effective. See, we could actually finish the lockdown off because we did the vaccination, and everybody, when they took the vaccination, the number of people dying came down substantially. And that was the reason we gave the vaccine. It did not stop people from getting COVID. In fact, it did not even stop people from spreading COVID to other people. It just stopped people from dying because of COVID. So nowadays, everybody is, the COVID is still there in the this thing. Mumbai, Pune still has a lot of COVID, but you're not dying because of COVID. Most people are not, and that is the role of the vaccine, COVID vaccine. Now, nirsevimab is not a vaccine; it's an antibody. So what it does is, this is the virus RSV and this is the nirsevimab. So it works like a key, like a lock to the key. So ये आपका चाबी है उसके अंदर. This चाबी is going to go and get stuck into the respiratory cell, आपका जो breathing वाला cell में, and this is going to cause infection. This is the virus going and tuck यहाँ पे जाके हो गया. Now what the antibody is going to do is it's going to come from here and block. It will be like a extra tuck. So when your antibody is stuck here, then this cannot go into the virus. So the antibody is going to block the virus from attaching to the cell. Thus, it will reduce the amount of infections. And if the infection does not happen, then the disease will not be severe. So it's a wonderful question. And the answer is that it will prevent your child from getting infected because of RSV. Or even if the infection occurs, because the antibody is binding to a majority of this, very small number of viruses will go in. Very small number of viruses means less infection. Less infection means less complications, and also remember, less spreading of virus to other children.
As wonderful this question was, Doctor, it was equally incredible of you the way you have been explaining this. I really appreciate this. Thank you so much for this. Moving on, Palak wants to understand, do we need to give it right after the birth of a baby?
Great question. So I don't see any fathers coming to chime in. It's only the mothers who are interested in the baby's health.
We did have one father in the
We have one
previous
father.
questions.
So maybe next time. Okay, maybe. Okay. So Palak, wonderful question. And the answer is that currently in India, we don't have any specific guidelines. It's a very new thing. This has been just launched a month back or 2 months back in India. So as I said, if you were listening from the very start, in America, we know when to give it. Best time is to start it in September, October, give it up to March. If you are born in April, then take it in next October. In Australia, reverse. If you are born in March, take it now. If you are born after July, August, wait till the next March. Simple. In India, there is a problem. One, the virus is there throughout the year in small amounts. And you have a lot of virus during two times: monsoons right now and winters, December, Jan, Feb. So it is possible for a child who was born right now to be given this vaccination right now. If the child is born, let's say somewhere in March, then you have to take a call along with the doctor whether you want to give it that time because there is some amount of virus circulation, or you want to take it before the season starts, which means somewhere in June, July, because it works for 5 months at least. So if you take it in June, July, you'll be protected from June till around December. If you take it in March, then the protection would probably end somewhere in September or so. So this is something which we do not have a clear answer, but I'm sure our parent body, which is the Indian Academy of Pediatrics, which has almost 50,000 pediatricians across India as a member, they will come out with some guidelines. And maybe next time, Palak, you're logging in, maybe after a few months, we'll have some more clear cut answer. But right now, we say if you're born in monsoons or winters, take it immediately. If you're born just after the end of winters, then maybe it might be good to discuss with your pediatrician as to whether you want to take it that time or a little later.
Chandrani? Chandrani wants to understand, does my baby need more doses in the future as well?
Okay, so the answer to that is no, unless and until your baby had a problem of being very premature, requiring oxygen, or your baby has some form of heart disease, some form of lung problems. And lung problem means in the first year of life. I'm not talking about asthma. I'm talking about something in the first year of life, like some internal problem. So if that is not the case, which is true for most people, then your baby does not need another dose. Again, the reason for that is very simple. RSV will happen to everyone, but the serious complications will happen in the first year, in the first 6 months of life, and that is why that is the time that we want to make sure that your child is protected against this particular disease.
Fazil here is asking one of the common questions asked by a lot of parents and wants to understand, does this cause any sort of fever, pain, or any other side effects for the baby?
Absolutely. Wonderful question again. Thanks. It's a lot of things which we didn't really talk about when we were talking to each other have been brought out very nicely by the parents. And this is important. See, why do we get fever? Because of a vaccine. When we take DPT or any other vaccine, why does the doctor tell you fever ho sakta aega and you need to do? Because the way a vaccine work is it stimulates your body to produce immunity against the vaccine. So in a way, the vaccine mimics the disease. It is going to behave like if you take the shot of let's say DPT, your body is going to feel, oh, there is a chance that there is a DPT bacteria is coming into me, and therefore it reacts. And in that reaction, it causes fever, pain, swelling. So that is a way of your body to react to this particular disease in its own way to protect you. And this is a way the vaccine works. And that's why many vaccines have different amounts of fever, pain, swelling, etc. Now, this is different. This is already pre-made antibodies. ये हमने सारा बना के we've already made that. We have told body you don't need to do anything. I'm going to do it in the factory itself. So you have made the antibodies. You are telling the body you don't have to make this. I'm going to give these straight away, and then you are injecting the antibodies. So there is no immunity required from the body side, and that is why the chances of fever, pain, swelling, irritability are extremely low. In fact, the studies which we talked about, phase 1, phase 2, phase 3, have not shown any difference between people getting the small babies getting the injection and small babies getting the placebo, which means no injection. They have found the thing to be absolutely similar. And so the answer is chances of fever, pain, swelling are very, very low with antibodies as compared to the vaccine.
Another question is coming in from a concerned father named Rajat, who wants to understand, मेरा बेबी 34th मंथ में ही हुआ था, उसके लिए क्या ये लेना सेफ रहेगा? What would you suggest?
Yeah. So good to have a few fathers coming in. Thanks, Rajat, for being so concerned. It shouldn't be all the job of the mother. So very happy. Uh, we discussed this, that if your baby is premature, they need this before other children who are born full term. So I'm not saying a full term shouldn't take it at birth. I'm just saying anybody who's premature, anybody's baby who has a heart problem, anybody's baby who's a lung problem, they need to take it ASAP. If they take it sooner, the chances of getting RSV complications become much lesser. And remember, these are antibodies. They do not require the baby to be full term, fully mature for the vaccines to work. Even though we give most vaccines also to babies, but still there is some concern about ki chota baby hai vaccine lagna chahiye nahi. But this is different. We are giving pre-formed antibodies. Hum paka pakaya khana we are putting into the baby. This is absolutely indicated for a premature baby. Talk to your pediatrician and take the particular antibody if it is available and if your pediatrician is comfortable with giving this particular.
Rupal wants to understand, एक्सपेक्टिंग मदर को भी रिस्क होता है क्या आरएसवी का? मतलब जब बेबी वूम्ब में है तो उसको हो सकता है क्या?
Okay, so hats off to all the parents. I think this particular parenting website has really intelligent parents. You have taken the cream. These questions are what we get asked by pediatricians, you know. So as parents, if you're asking these questions, I'm thoroughly impressed. So the answer is there is a maternal vaccine called which is available in US and many other countries. So they give the vaccine to the mother, but it is primarily for the protection of the baby. Mothers do not get serious RSV in most situations. If the mother is immunocompromised, if the mother has certain problems, again, voice up, lung disease, heart disease, then there is a possibility she can get serious RSV, but it is very rare. This vaccine is given to mothers in the third trimester, just like your tetanus and flu in these countries, but it is primarily to protect the babies because the antibodies which go through the mother into the babies will protect the baby. Primarily, the mother obviously will get some protection as well, but that is not the reason why it is primarily given. It is given to protect the babies. Good question, though. Thank you.
Another question is coming in from Anu, who wants to understand, यदि 6th week में मिस हो जाए किसी वजह से तो क्या 9th week में किया जा सकता है ये वैक्सीन?
So first of all, okay, so let me clarify. One is before that last question, maternal vaccine is not available in India, not likely to be available for the next 2-3 years. So we don't have that in India anyways. That's number one. Okay, this is not a vaccine. Number two, this is an antibody. So the time to give this is not 6 weeks. 6 weeks you give DPT, polio, hepatitis, pneumonia, rota, etc. This is an antibody. The recommended time is ideally in the first week after birth before discharge. That is the recommended time. If your baby is born right now, I would want to give it before the baby leaves the hospital, because rains, winters is the time when you get RSV. Now is the time when a lot of admissions are happening because of this, and you don't want to wait. So 6 weeks, 9 weeks, nothing like that. You can give this vaccine up to the age of 8 months. So you can give it up to 8 months. But if you wait, there is a small chance that your baby will get RSV before, which basically means that the chances of complications will happen. Remember, 2 out of 3 babies are going to get RSV before they're 1 year old. So you need to give it sooner than later, especially when there is monsoons or it is winters.
Hope this was helpful to you, Anu. Moving on, we are getting a question from Shrishti, who wants to understand RSV के क्या symptoms हैं? मेरी बेबी को 8 days से वायरल है and ठीक नहीं हो रही है. So क्या ये RSV हो सकता है?
So I don't know the age of your baby, but definitely cold, cough, fever can always be RSV. There is nothing very specific about RSV. It doesn't come key suddenly, like you have bleeding and then it is dengue, or if you have, the seizures and then it is some brain fever. Aisa nahi hai. RSV is just like any other cold, cough, fever. Remember, every child is going to get it before they are 2, which means that it is just like a normal khansi, zukham, bukhar. If your child has fever for 8 days, then I would not be keen on labeling it as viral unless your pediatrician has seen your child and they have tested your child, they have seen the ear, throat, stomach, and done blood test if required. So 8 days viral is possible, but we need to rule out bacterial conditions. RSV should not normally cause fever for 8 days. So I would like this baby to be seen by their pediatrician. But there is nothing very special about RSV in terms of the symptoms. Colds, coughs, fever are the most common things. And the serious ones, babies, of course, will get all other things like breathing problems and lethargy and not feeding at all and passing less urine and stuff. But that is for serious infections.
We're getting a lot of questions from the parents, but unfortunately, Dr. Gaurav, we are running out of time as well. We have time constraint. That's why we cannot take all the questions. But thank you so much, Doctor, for this wonderful session. And also, thank you to all the parents who have joined this. I really hope this workshop was helpful to you all. Thank you.
Thank you. Thanks for having